in today's era, when we are talking, when all of us are quite, our knowledge is advanced, we know things, there is social media, there are so many other ways of getting information. So an idea about infertility is there in everybody. But at the same time, when a woman is trying or the couple are trying and it's not happening, it leads to a lot of causes, concerns, unwanted advices, and sometimes unrequired tests are being done to know what could be the cause, when things might be very simple, or at times there are certain things which require immediate treatment. So when couple don't know where to go, whom to contact, so that it leads to a lot of unwanted concerns. So the whole idea of today's webinar is to clear these doubts in the mind of people, so that they know when to contact a doctor, what are the reasons for which they might have to contact a doctor, what are the times when they can say, okay, let me wait, let me see what's happening and then get back to my doctor. So these are certain things which are always the doubts lingering in the minds. So the whole session is to dispel these doubts. Okay, so when we say fertility, so for everything we say, even there is an old saying that time and tide doesn't wait for anybody. Kala yargu kaya life, there is somebody who can follow Kannada. So in that case, when it comes to fertility, the most important factor we tell is age. If somebody says, no, you are married only for 1 year, you can try for some more time, or you are married only for 6 months, at the age of 37, I will not ask somebody to wait even if they are married for few months. So in that way, when we look at the age of the woman, right now I will be talking from the perspective of the age of the woman. When we look at the age of the woman, we say when a woman is less than 30 years, her fertility window is at its peak. That means previously you would have seen girls getting married in India. The age of marriage has always been 18 for girls and 21 for boys. So when a girl marries at 18, though now yes, the age of marriage has also come up to almost 25. When a girl marries at 18, 19, 20, her fertility window is at its highest peak. So within few years of marriage, she has a very good chance of conceiving. So when we look at young couples, like the girl around between 23 to 27 or less than 30, and the boy is also less than 30 years, their fertility window is at its peak. Around 80 to 85% will conceive within 1 year of marriage. That's quite good. We can't expect everybody to conceive in the first cycle itself, right? There are certain couples who come to us. I have tried this month, I did not get conceived, they get tensed. That is what I said. When to contact a doctor? When can you say, come on, let me wait, let me see what the problem is and then meet the doctor. So 80 to 85% of the women will conceive within 1 year of marriage. That means when they are having regular intercourse. When I say regular intercourse, the woman should be having regular cycles. Regular periods means once in every 28 to 30 days she gets her periods. Sometimes it could be as much as 35 days. Bleeding for 2 to 3 days or maximum of 5 days in a month. She should not have very severe pain during her periods, what we call as dysmenorrhea. So very severe pain during periods also can be indicative of sometimes a cyst, what we call as endometriosis, or it could be because of fibroids, that is some growths in the uterus. It could be because of polyps, that is endometrium, that is within the lining of the uterus. If at all there is a polyp that occupies space, makes the area non-productive, and that is the reason why they might have problem during conception. And also, if at all she has been tracking her ovulation, it helps her to time it properly. But for a young couple who are married for a short period of time, who are planning, my advice will be not to track ovulation through apps or the ovulation kits and all those things. See, a woman who is having 28 to 30 day cycle, we know that she is ovulating around day 14 to day 15 of the cycle, right? So at least having intercourse from day 11 to day 19 of the cycle on alternate days. We don't even advise on a daily basis. On alternate days itself is enough to help her conceive. But let me say, a woman who is having a 35-day cycle, does it mean she is not ovulating? No. She is still ovulating, but probably her ovulation is happening on 21st day of the cycle. That means they should extend their fertility window or their time of trying till at least day 23 of the cycle. So at least from day 13 to day 23 of the cycle, which should cover. So this is for couples who are having regular cycles and who are just married for few months or trying since a few months. But at the same time, if somebody is married for a longer period of time, then the investigations, the mode of treatment, the counseling, everything will vary. Now, if I look at a woman who is a little elder, that means around 30 to 35 years, we know that the fertility declines as women advance in age. Now, there are a lot of my patients who come and ask, this Hollywood actress conceived at that age. We'll say if at all there is somebody who is from Andhra who knows the Koridella family. We all know Upasana conceived so late, but at the same time she has also been very vocal about the fact that she has preserved her oocytes. That is one of the ways by which we can time our family and all those things. But yes, if we look at in general, as women advance in age beyond 32 years, I am speaking about Indian women, I am not talking about our Western counterparts. I agree that we try to copy everything from our Western counterparts, be it their dressing sense, be it their food habits, but at the same time our physiology is different. We Asians, our reproductive age is 6 years ahead of our American counterparts. That means American women at the age of 38, whatever is an ovarian reserve, in an Indian woman it may be as less as 32 years. So the reserve starts declining. That means chance of conception in 1 year also reduces, quality of the egg reduces. Our body has been exposed to the external pollutants, toxins, chemicals, pesticides for all these years. So naturally the quality of the egg reduces. After 40, it drops significantly, because all of you would have heard your mothers, your aunts telling, no, by 45 I stopped getting my periods, I attained menopause. There could be a family in which women usually attain their menopause much earlier. So these are all the factors which we need to consider. It's not necessary that my mother attained menopause at 42, but I will attain menopause at 48 because my diet, my lifestyle is good. Yes, agreed, it is very important, but at the same time genetics plays a major role. So what we need to remember is after 35, or I will say around 37, there is a noticeable fertility decline. There is a decrease in the egg quality and quantity. Because the quality of the egg, or for that matter the sperm quality reduces, there is a slightly higher risk of miscarriage, abnormal embryos leading to some abnormalities in the babies. So we advise that whenever you are in that stage planning for your pregnancy, please seek the help of a practitioner or a fertility specialist. That apart, what are the conditions which, if you know, you are going to meet a doctor, or probably on meeting the doctor might be explaining about these things, and you shouldn't get worried when you hear these words. Now, the most important thing in a woman to help her conceive is the ovulation. That means she should get her egg released every 2 weeks, once in a month. That means once a woman gets her periods, within 2 weeks her egg will be released. But there are certain issues wherein the woman doesn't release her egg at all at any point of time, or even if she is releasing, it is happening probably once in 2 months or once in 3 months, or sometimes it can happen as early as 10 days. So what do we do in such conditions? Yes, if a woman is regularly having a 23-day period, let me say, in that case her ovulation is happening on day 9, day 10. So they should start having their intercourse from day 7 itself. Not that every woman should need not ovulate on day 14 is something we all have to remember. At the same time, all of us know about PCOS. Lot of my patients come and tell, I have PCOS, I have that problem, this problem. PCOS is nothing but the fact that the number of follicles, right? The number of follicles in the ovary are much higher than what we see normally. Normally we say around 8 to 10 follicles in each ovary is normal. Here probably it's 20, 25, 40 per ovary. That means there are so many follicles that the body doesn't know which to send first. It is like this, too many are there, like too many vessels make noise is what we tell, no? The same way, when there are so many follicles, there will be hormonal imbalance, because of which the follicles don't grow at the right time, ending up as small follicles everywhere. When we look at PCOS, so it is polycystic ovarian syndrome. So the cyst is a misnomer, it is not cyst, it is just that they have large number of follicles. So in a way, yes, it is good that they have enough number of follicles, but the very fact that there are many in number is causing the problem. So certainly we need to keep in mind that when a woman is not having a girl, so if at all somebody is there hearing this webinar who says that my daughter is now 14 years old but her cycles are irregular, I will still say it's okay, because the body takes the what we call as a HPO axis, takes some time to regularize. It's like we go to the school or we go to a hostel, we don't get adjusted immediately, right? So the same way the body takes some time to adjust to the fact that woman is ovulating, getting periods. In that case, first 2 years after attaining menarche, that means first 2 years after attaining the periods, cycles might be irregular. There is absolutely no problem with that. But beyond that, if somebody's cycles are becoming irregular, that is when probably a consultation with a doctor will be ideal. That is one thing. Second thing, today we all hear about thyroid abnormalities, right? It's become very common. You ask anybody, everybody knows about thyroid, prolactin, PCOS and all those things. Again, there are a lot of reasons for thyroid abnormalities. It could be because of stress, it could be because of genetic factors, and of late we are seeing a lot of women who are having autoimmune. That means the body is producing certain cells against its own cells. So the thyroid hormone production is not proper. So whenever there is a problem with the thyroid hormone, along with that there is one more hormone called prolactin. When these two hormones are abnormal, so we need to remember that they usually go hand in hand. So when these hormones are abnormal, it can still lead to irregular periods. Irregular periods, no ovulation or no proper ovulation. Again, she doesn't conceive, that whole cycle will go on and off. So it becomes a vicious cycle. So first thing, if somebody is having irregular periods, not necessarily that they should think that they have only PCOS. These are some of the things which needs to be tested. I will come to one more very important point. Anybody who has irregular periods, slightly obese, that means their body weight is slightly on the higher side, people will say, even friends, colleagues, somebody might say, you have PCOS, even I had the same problem, but I just took some medicines, I did some weight loss, I got my periods. Next comes tubal issues. Now the woman is ovulating, but where do this egg and sperm meet? They have to meet somewhere. So that is called the fallopian tubes. So if the fallopian tubes are blocked or they are not doing their job properly, what happens? The egg and the sperm will not be able to meet, so the chance of conception is not there. So woman who is regularly ovulating but at the same time not able to achieve conception, in the meantime the husband's semen parameters have been checked. She is tried for 1 year or depending on her age 6 months, 8 months. The next thing what we need to look at is tubes, fallopian tubes. These are two tubes on either side of the uterus which will help to transport the egg and the sperm, make them meet together, form the embryo, the early stage of embryo, the first 1, 2, 3 days of embryo. Slowly it comes to the uterus by 5 days of its existence. So the tubes are very important for natural conception. If the woman has blocked tubes or damaged tubes, sometimes very abnormal tubes can be seen on ultrasound, or else we need to remember that ultrasound is not at all the investigation for checking of the tubes. A basic ultrasound, if at all the tubes are abnormal, will only talk about hydrosalpinx or hematosalpinx, but otherwise if tubes are not seen on the ultrasound, doesn't mean that they are normal. So we need to check for the tubes, what we call as HSG, hysterosalpingography, or through ultrasound guided also we can do a procedure called sonosalpingography, or if somebody requires any other procedure, abdominal surgery, then certainly we can do a tubal chromoperturbation test, which is the best to know the quality of the tubes. So if all the tubes are not working, then there is no chance of conception. So a couple tried for 1 year maximum, has not conceived, the next step they will think about is HSG. In the meantime, when we are also looking for the ovulation, we are looking for other parameters, what we can see is uterus. What is the condition of a uterus? Because ovulation is happening, egg and sperm have met, they have to come back and sit in that uterus. If the uterus is not conducive, or it has some abnormalities which will prevent the embryo from sitting there, that is when we see that there can be implantation failure. So what do? We look for fibroids. Garbhakoshada gadde anta ಹೇಳ್ತಾರೆ. Okay, if there are fibroids, fibroids per se, smaller fibroids will not cause any problem, but multiple fibroids more than 4 centimeters in size or sitting at abnormal positions wherein it can affect the growth of the baby. These are some things which can affect either her chance of pregnancy, yes, along with that her chance of continuation of the pregnancy. First thing is women getting pregnant, but along with that the next important thing is also that pregnancy continues till term. We have a healthy mother and healthy baby at the end of those 9 months, which we need to remember. It can also be the presence of polyps. That means I told that there are some growths in the endometrium, that is the lining of the uterus. If it is there, let's take a simple situation wherein already there is somebody sitting in our place, like a musical chair if we say. Okay, if already there is somebody sitting in our place, then there is no place for me to sit. That means there is already a polyp in a place where the embryo has to come and sit. So that then the pregnancy cannot occur there. It makes the area not good for implantation. So if at all there are multiple polyps, it has to be removed before the healthy pregnancy can occur. Presence of endometriosis, that means some blood-filled cyst in the ovaries, or adenomyosis, that means the uterus becomes bigger than normal. Whenever it becomes bigger than normal, its ability to hold the embryo or continue the pregnancy reduces. So these are certain things we need to keep in mind. Also, I told in the beginning that age is the most important parameter as women becomes older. Yes, for that matter, even in men, age is very important, but then the nature is a little more kind to men than in women, I would say. So in women, after the age of 35, the reserve starts reducing. But in men, I would say probably after the age of 45 is when the reserve starts reducing. So whenever there is a reduction either in the egg quality or the sperm quality, certainly the chance of conception will reduce. So the best age to conceive is probably 25 to 32. Beyond 32 to 37, yes, the reduction of the reserve and the quality starts, and beyond that it will be much more faster. Like every 6 months the reserve starts reducing. Every year your ability to have good quality of embryos will reduce. Every year the risk of abnormalities in the baby, all of us would have heard about Down syndrome, trisomy 21 and many other abnormalities, or autism. Nowadays, if anybody of you has heard about autism, that is neurodevelopmental disorders will increase as the age of the parents will increase. So we need to keep all these factors in mind before we say I want to delay my pregnancy or let me plan my pregnancy at a certain period of time. So these are all the things which we need to keep in mind. So all this while I spoke about the female. Can we let go of the male? Certainly not. So for a good embryo to form, egg quality is important. At the same time, the sperm quality is important. But we give more importance to the woman because she is the one who is going to carry that baby till term. But at the same time, if a man has low sperm count or he is unable to produce the semen sample, these are two important conditions wherein we are seeing that they find it difficult to achieve a pregnancy. So if at all somebody is not able to have regular intercourse or is having difficulty in attaining an erection or not able to ejaculate, it doesn't mean that their semen parameters are not good. It is just that they might be having some hormonal imbalances. Sometimes it could be as simple as anxiety issues. We are all living in a very cutthroat world wherein, yes, anxiety is an issue which we need to keep in mind. So that can affect their performance ability or something called performance anxiety. That means when a couple comes to the OPD, like we usually see them in the OPD when they are trying normally, and we say these are the important days for you to try. So what happens? It induces anxiety in the male and he may not be able to perform on that day, what we call as performance anxiety. Very common. So if somebody is having performance anxiety, I will say them not to worry, forget about it, things will be fine. But at the same time, if it is causing any other issues, then it's always better to meet a fertility specialist. There are certain hormonal disturbances, abnormalities from birth, what we call as hypogonadotropic hypogonadism. So that is something, yes, because of which there will be a problem in the growth of the boy. So most of the times they would have started treatment from the time of their high school days and all, so that by the time they are actually planning for pregnancy, their hormones might be in a better position for them to help achieve a pregnancy. But at the same time, if somebody was not treated, we can always start the treatment. This is one of those very important conditions, right, where giving medicines will help them to get the sperms. But here we need to remember that patience is the key, because there is no treatment which can happen in one day. It's not like dolo or paracetamol. Patient comes with a fever, I give a dolo, the fever reduces. Here the treatment, the person should be consistent in taking the treatment, ready to wait sometimes probably for 1 to 2 years before the sperms are seen in the ejaculate, but still they are the ones who can always get good outcomes. Okay, and again, one is count. So when it comes to the semen parameters, unlike in women where we see multiple things, in man there are only 3 important factors. One is the count, second is the motility, that means the movement of the sperms, because the sperms have to swim to reach the tube, meet the egg, mix with the egg and form the embryo. The other one is morphology, that is its appearance. Okay, so anybody, like we say, a person who is appearing nice need not be a nice person. Like when I was young, I always used to feel Amrish Puri is a very bad person because he used to be a villain in most of the movies I saw. So something similar to that, a sperm with a poor morphology need not have a bad DNA, but again, if the morphology is not good, it might not be able to enter into that egg. So that is something we need to keep in mind. So any man where is either the sperm count, motility or the morphology. Morphology means appearing normal. Every sperm will have one head, one midpiece and one tail. So any of these is abnormal, their chance of conceiving will be lesser. Why does it happen? As I said, some are genetic. That means there is always a genetic cause by birth or some problem with the chromosomes at the genetic level. The other one is induced by us. When we say by us, it is our lifestyle factors. It could be either smoking. Yes, smoking does affect every part of the body. At the same time, it will affect the sperms in the fact that their motility will reduce, and probably, yes, it will also sort of reduce the quality of the sperm by increasing its DNA. Okay, when we tell DNA, it causes the damage of the DNA, which itself will increase the DNA fragmentation index, thereby reducing the chance of conception, or at the same time reducing the chance of the continuation of that pregnancy. So these are certain things we need to keep in mind. So when it comes to stress or smoking, alcohol, it will certainly affect either the male or the female. How does this stress affect? Yes, we all have heard about stress. We are all in a stressful situation because either it could be work related stress or it could be some personal situation which is leading to stress. So basically it will cause a hormonal imbalance which can affect ovulation in female and at the same time the performance in the male. So basically it can reduce the libido. That means the man is not able to attain erection, or probably there is a premature ejaculation, or they can have performance anxiety. In women, if there is no ovulation, again it causes a vicious cycle wherein there will be hormonal imbalance, she will put on weight, stress induced eating or lack of sleep. All these things will affect the ovulation. At the same time, it can impact sperm quality, and chronic stress certainly has an effect on the outcome. If a woman is not able, if a couple, basically both men and women are not able to get proper sleep, it will again affect the circadian rhythm. That means what we say, we get up at a particular time, sleep at a particular time. So when we talk about sleep, there are a lot of studies again, so many of these influencers have spoken, prominent individuals have spoken. So 7 to 8 hours of sleep is always ideal. But again, a day we might sleep more, a day we might sleep less, but on an average, minimum of 7 hours of sleep for a couple who are in the reproductive age is very good. Again, if somebody says, I sleep at 2 in the night and get up at 9 in the morning, I won't say that is very good, because it's always better to maintain the circadian rhythm. Too much of weight loss, too much of weight gain, again not good, because it can lead to hormonal imbalance, it can lead to irregular ovulation, and certainly weight gain in men will lead to poor sperm quality. They are not able to probably perform better. A couple with a very high BMI, their libido will be affected, their ability to perform will be lesser, thereby affecting the chances of conception. We already discussed about the effect of smoking on the fertility health. Basically, it will affect the egg and sperm quality. Again, smoking in women just before or during pregnancy can increase the risk of miscarriage, can cause the baby to be born preterm before time, can reduce the weight of the baby, what we call as IUGR. All this will have a long-term impact on our children. So basically all we want is our children to be very healthy, right? So when it comes to that, smoking and alcohol are certainly a taboo. So there should be a total no for smoking and alcohol. So we just now discussed what are the conditions which can cause some difficulties in conceiving, or what are the certain things which should be done. So when do we seek the help from a fertility specialist? As I said, every couple who is married trying for a month or two need not get worried. They need not rush to a clinic to get some tests done or to meet a doctor. But certainly if a couple who is less than 35, I will say probably less than 32, trying for at least 1 year, if they have not conceived, they should meet the doctor. At the same time, if there is a woman who is 30 years, she knows that her cycles have always been irregular. She need not wait till 1 year to meet the doctor. If at all a girl knows that she has polycystic ovaries, or probably she knows that there is some issue, or sometimes she might have had some chronic disease during her childhood. In India, tuberculosis is so common, and tuberculosis need not affect only the lungs. It can affect every part of the body. So if somebody has been affected with tuberculosis or chronic diseases, or sometimes some autoimmune conditions, it is better that they meet the fertility specialist before even planning for conception. At the same time, a woman who is more than 35 years, trying for 6 months, not conceived, I will suggest that she meets the couple meets the fertility specialist. We already discussed about the irregular periods or some other health conditions. Again, in a male, if at all he has had any surgery for hydrocele, or there is a problem with the libido, not able to maintain erection, or not able to maintain, have proper ejaculation, or probably he was affected by certain conditions in childhood, on long-term medications, like sometimes if at all I can say something like epilepsy or any other long-term medications, it is better to meet a fertility specialist. Again, anybody, a man or a woman, can get their fertility evaluation done even before marriage also. There is no strict no for them to not do these investigations before marriage. There are a lot of men who come to our center to get the semen analysis done, and lot of women who also come to check their AMH, that is the ovarian reserve and all those things, or even to see if there are any fibroids, endometriotic cysts. But again, a presence or absence of a condition doesn't say that you will not conceive. Only as a specialist, all I can say is that yes, you might have some challenges in achieving a conception. So don't delay that trying for pregnancy. Unless a couple tries for few months, nobody can tell that they will not be able to conceive. There are certain conditions wherein we might have to counsel them specifically, but most of the times either a slightly lower semen parameters, presence of a fibroid doesn't mean that they will not conceive. At the same time, somebody is married for some time, have been trying for pregnancy, achieved pregnancy, but the pregnancies are not continuing, or any other known factors, family history, something specific, like now we see, because of the knowledge available, because of the tests available, there are certain families wherein there is a very high risk of cancer, or there are certain families where there are certain heritable diseases, like which runs only in the female lineage, which runs only in the male lineage. They don't have to wait till they conceive and have a mishap. They can always meet the doctor first. There are certain treatments, like I can give an example called PGTM. That means you look for the disease in the embryo, not use that embryo, transfer only the good embryo, and allow the couple to have a normal baby. So these are certain things, if at all known, I will suggest that they meet the specialist as quickly as possible. As I said, certain tests can be done anytime. For a female, if at all she wants to do one hormone test, AMH is a test which can be done anytime. It's not specific to the time of the day or the time of the cycle. Can be done on any day. Whereas if somebody wants to know, along with the quantity, what is the quality? I won't say that these are all perfect markers. Okay, the only test for pregnancy is pregnancy itself. It's a very old saying which my teacher also taught me, and I think it still stands good and has stood the test of time. But at the same time, if somebody wants to know the quality of the oocyte, then FSH and estradiol levels on the second day of the cycle will give a fair idea about the quality of the oocyte. Ultrasound done on the second or third day of the cycle, that means the beginning of the cycle. If a woman has around 7 to 9 follicles in each ovary, I will say that her reserve is fairly okay. Somebody is planning for pregnancy, ovulation tracking either in the form of ultrasound or by doing the urinary LH kits. If somebody asks me which is better, I will always say ultrasound is better, because along with the size of the follicle we get to see the endometrium also to know if at all it is in sync. And already we discussed about the tubal patency test, when to do and how to do that. For men it's very simple. The only test which is really required is semen analysis. If the semen analysis is very abnormal, then at times we go for hormonal evaluation, what we call as the same hormones like FSH, LH, E2. Even in men also they have the same reproductive hormones, but the way it is analyzed, the way it is read is slightly different. So these are some of the basic tests, minimum tests, which have to be done to know if at all there is any problem. If there is a problem, yes, we suggest them the necessary things. If there is no problem, try for 6 months and then let's see you back. This is about the basic test which we spoke. Now there are a lot of myths when it comes to infertility, for that matter, in every field, but when it comes to childbirth, because it's a very emotional subject. Getting pregnant is a very emotional thing, and there are a lot of myths for which probably there are some basis for some and no basis for some at all. So infertility is only a woman's issue. I think now I can safely say that we have come to a stage wherein men also understand that males also contribute equally to infertility. Because if I tell, what happens medically is, if 1/3 of the women, when we see about 30% of the women might have a problem only in them, that means whether it's a tube or ovary or something like that. 30% of the men can be sole contributors, like they might not have sperms at all, or the quality of the sperms is not good. Whereas in the remaining 40 to 50%, both of them will have a problem. That means her reserve is slightly on the lesser side, her number of follicles are less, his sperms are less, or something like that. So the fact is that both men and women contribute equally to the causes for infertility. Now coming to the second myth, stress alone causes infertility. Stress does cause infertility, no doubt about it, but at the same time that's not the only contributor. The fact that she had irregular cycles from the beginning, the fact that he had some surgery, that means at the birth of the baby boy, so his testis was still higher up, they had to do a surgery to bring it down into the scrotum. Already there was some problem there. So certain problems like these can be the usual contributors for infertility, and stress can only exacerbate it. The stress can be a reason for giving trouble when the couple are conceiving, but that's not always the only cause for infertility. Now coming to the most common myth, yesterday also I was seeing an influencer who said that doctors will only send for IVF. No, IVF is the only solution. I will never agree to it. When you look at busy fertility practitioners or wherever we do fertility practice, right, approximately only 20 to 25% of our patients are the ones who are taking IVF treatment. The majority of the patients, that means remaining 70 to 80%, usually either conceive naturally or with simpler treatments like ovulation induction, or with IUI, or by just removing those fibroids, polyps, and sometimes if at all they have had multiple miscarriages, treating for this miscarriage. So whenever a couple come to a fertility clinic, they are only advised IVF is certainly a myth. The majority of the patients conceive without IVF. It's only the remaining patients who might have really those conditions which might not be treatable naturally will go for IVF. Again, you can conceive any time. Gone are those days when people used to think that if they have intercourse during periods they will conceive, or if they have intercourse during a full moon or new moon, those things. Now I'm pretty sure that nobody has this myth. So people are usually more they are more knowledgeable about these things nowadays. So timing and ovulation does matter. So basically a woman who is regularly ovulating, having intercourse between the 12th to the 15th day will have higher chances of conception. Again, in a woman who is not regularly ovulating, having intercourse every 2 to 3 days once will certainly improve her chances of conception. In spite of trying for some months, pregnancy doesn't happen. What is the next thing to do? Meet your doctor. We already discussed in detail about the next myth, age doesn't matter. But I will certainly tell that age does matter. Time and time again I say that doesn't wait for anybody. So if a woman's age is higher, her chance of conception will reduce to an extent that at the age of 42, the chance of natural conception is only around 3 to 5% per cycle. Which, yes, through the medication, through the treatment like IVF and all, we can increase in that particular cycle where they go through the treatment. But at the same time, age does matter. Okay. So these are some of the common things which I've heard. Along with that, I've also heard that people shouldn't be eating papaya. Absolutely, I agree, because papaya contains papain. If you eat it in greater quantity, it can have a negative effect on the pregnancy. People shouldn't, they also say that you should not eat pineapple. Yes, pineapple is an acidic fruit, so probably it causes more acidity, burning and all those things. So we usually don't advise pineapple. People say that you should only eat these kinds of foods, these kind of seeds. There is nothing like that. A healthy and wholesome diet is what is required when a couple is conceiving. Let's discuss what are the simple and most common doubts, what are the most important things which are required when a couple is planning for pregnancy. So if anybody has any questions, I see that Naina here has a question. Yeah, Naina, I can read your question here. If fallopian tubes are blocked, what's the next best option to do? Yes. Yeah, Naina, it's a very good question. So if the fallopian tubes are blocked and it is seen in HSG, if a fallopian tube is blocked, no, the block can be at various sites. A fallopian tube has multiple places. It can be at various sites. A corneal block, through hysterolaparoscopy, we can try to open it, approximately possible in 60% of the cases. If it is possible to open, then you can try naturally. If the husband semen parameters are good, then chance of natural conception is very good. But if at all it is blocked somewhere in the middle of the tubes or is not able to unblock even after hysterolaparoscopy, then IVF is the only solution, because otherwise there is no place for the egg and sperm to meet. Are there specific lifestyle changes such as diet or exercise routines that are proven to boost fertility? Okay, I won't say that there is any specific lifestyle change which will help to achieve pregnancy, but certainly having a proper sleep routine, that is a proper circadian rhythm, get up at the right time every day, get sleep at the right time, have proper nutritious diet, some kind of physical exercise of at least 45 minutes a day for 5 days in a week. These are some of the things which are known to improve the fertility. Again, diet, I will say a healthy diet which is nutritious. Basically, we don't say that one should have this much of grams of proteins a day, this much amount of potassium a day. There is nothing, no basis behind it. A healthy diet, if at all somebody is overweight, trying to reduce the weight by diet and exercise, all these things will have a improvement in the fertility. Any food rich in antioxidants, vitamin D, all these fruits and vegetables are known to boost the fertility. There is no particular age limit for conceiving, but in India, since the marriageable age is only 18 and above, so that is why, because a woman's reproductive organs are still developing, her bones are still developing, so anybody conceiving before that age is not healthy for her. But yes, beyond 37 years, again, as I said, our chance of conception will reduce. Because as I said, our Indian women, our fertility window is slightly shorter. So probably a chance of conception will certainly be lesser beyond 37 years. But when it comes to treatment, as per the Indian rules, a woman who is more than 50 and a man who is more than 55 cannot go through any fertility treatment.